All right, here we go. Good morning. It is the 24th of all days, 24th of March, and a Tuesday here. Town meeting program ready to roll. Brought to you by Cordova Wireless Communications, your local cell phone provider, which is providing your local talk program, which has been busy, as have been many talk programs in media of late, covering the pandemic. And we're going to just jump right on in here, starting with the latest local information of interest before we get on to the statewide details. And there's a lot. And particularly with regard to travel, it's pretty important, because something that, if you have been following different Cordovan grassroots sites regarding the pandemic, there's been a level of concern about travel, obviously, which is the way that if the disease is going to show up here, it's going to be brought in by somebody from outside. So, folks on the street calling for completely shutting the airport down, which obviously can't happen because of the need for emergency travel and so forth, to the other extreme, which is, too much government intervention and so forth. Well, there's been some decisions made at the state level, and we'll go over those because there are some pretty significant penalties for violating them, and everybody needs to know about that. So that'll be coming up here shortly. By the way, if you miss any of this program, we expect to have it on our YouTube channel. Robbie created the Cordova TV channel, youtube.com/Cordova TV. So you should be able to hear this there. And we invite you to do so if that suits you. Again, we want to start locally here. From the Cordova Prepared folks comes an announcement that CCMC will be accepting donated personal protective equipment at this time in response to the COVID-19 outbreak. PPE, of course, is, the things that the healthcare workers use to keep the disease off of them so they can take care of other people. And these things have been in short supply in the midst of the outbreak. Items must be in working order and in usable condition. The following items will be accepted: N95 masks, PAPRs, not sure what those are, but those in the know, I'm sure. Face shields, Tyvek suits, shoe covers, goggles, disposable thermometers, and bandanas. If you would like to donate any of these items, please contact Angela at 424-8293 to schedule a drop-off time. Supplies and equipment will be used only as deemed necessary and will be returned if possible. Again, that phone number to reach Angela is 424-8293. Now, moving on to state news regarding this. From the Department of Health and Social Services, an announcement yesterday that they had officially discovered 4 new cases of COVID-19. All of the new cases were adults living in Anchorage, and all are travel-related. 10 new cases were detected Sunday, bringing the total case count as of 3 p.m. Monday to 36 total positive cases in Alaska. And then they mention keeping yourself and your family safe by getting information from coronavirus.alaska.gov. So 36 positive cases in Alaska so far. Now we'll start getting into this critical information about travel, which comes from the latest COVID-19 health mandate issued by the governor, by Commissioner Crum of DHSS, and Dr. Zink, the chief medical officer of the state of Alaska. This new mandate goes into effect March 25th at 12:01 a.m. and will be reevaluated by April 21st, with the ongoing goal, of course, to flatten the curve. I'm sure you're familiar with that term, and prevent the spread of the virus. Flattening of and just as a sidebar, people that have been following this, I'm sure, know that flattening the curve doesn't necessarily mean that the overall number of people who will be exposed to this is going to be a whole lot less. But the idea with all of the social distancing and the quarantining and everything like that is so it doesn't spread so fast that it overwhelms healthcare systems. If it can reduce the number of people who catch the virus, that's great. But flattening the curve doesn't necessarily, and all of these measures to flatten the curve doesn't necessarily accomplish that. It just keeps a whole lot of people from getting it to the point that you have to do, you end up maybe having to turn people away to make, you hear about these decisions they're having to make in Italy with their healthcare system being completely overrun. They're actually having to choose which people to treat and which not based on survivability. A terrible, almost wartime thing to have to, for the medical people to have to go through. And they don't want to see that happen in this country, in any of our cities or anything. So that's again why it's not necessarily going to prevent everybody from getting it, but it'll prevent a lot of people from getting it at once and overwhelming the system. So this health mandate from the state regards international and interstate travel and is an order for self-quarantine effective 12:01 a.m. March 25th. All people arriving in Alaska, whether resident, worker, or visitor, are required to self-quarantine for 14 days and monitor for illness. Arriving residents and workers in self-quarantine should work from home unless you support critical infrastructure. And we're going to talk about who those people are. There's an attachment to this that we'll go over that explains the critical infrastructure people. Critical infrastructure, this order says, is vital to keeping Alaska safe, and as a result, businesses and employees of critical infrastructure industries must take special care to protect their staff and operations during the pandemic. If your business is considered critical infrastructure and your workers must travel to enter Alaska, you must submit a plan or protocol for maintaining critical infrastructure to the Department of Commerce, Community, and Economic Development by 3 p.m. today, that's March 24th, outlining how you will avoid the spread of COVID-19 and not endanger the lives of the communities in which you operate, of others who serve as a part of that infrastructure, or the ability of that critical infrastructure to function. So again, there are some exceptions to this order based on the type of operation having people coming back into the state. And we'll go over what those are in a little bit. Those types of operations need to have their plans submitted by this afternoon. Pursuant to the governor's declaration, the state of Alaska hereby orders the following. Upon arrival in any community in Alaska from another state or nation, you must, number one, proceed directly from the airport to your designated quarantine location, which is the location identified and affirmed by you on the mandatory State of Alaska Travel Declaration form. And this is a form that came out with this order, and I've got one to look at here, and we'll go over what's on there so you can know what to expect in terms of what you're supposed to report. Kind of think of it like customs. If you've ever come in from the country and you declare stuff that might be in your luggage and that kind of thing, it's sort of similar. Now, if you're a resident, your designated quarantine location is your residence. If you are a visitor or worker, your designated quarantine location is your hotel room or rented lodging. So that's where you're supposed to go. As soon as you get in, you go right directly to there based on what you put on the form. Requirement number 2, you need to remain in your designated quarantine location for a period of 14 days or the duration of your stay in Alaska, whichever is shorter. Now, under item 2 there, some additional details. A, you may leave your designated quarantine location only for medical emergencies or to seek medical care. B, do not visit any public spaces, including but not limited to pools, meeting rooms, fitness centers, or restaurants. C, do not allow visitors in or out of your designated quarantine location other than a physician, healthcare provider, or individual authorized to enter the designated quarantine location by unified command. Item D, comply with all rules or protocols related to your quarantine as set forth by your hotel or rented lodging if you're one of the people that's not going to be at home. And then item E, if you're required to self-quarantine and there are other individuals in your residence, hotel room, or rented lodging, you are required to comply with social distancing guidelines. That's the 6-foot rule, obviously. Now, here's the kicker, and why this is important information to know. Failure to follow this order is punishable by a fine of up to $25,000 or imprisonment of not more than 1 year, or both, pursuant to a couple of Alaska statutes. So this is not something that you probably want to say, oh, it doesn't apply to me, oh, I don't feel sick, oh, everybody's overblowing it. Because in addition to receiving the evil stares and unpleasant reactions from your fellow community members, and there are a lot of community members who are not happy about the idea of people just lollygagging around in defiance of this guidance. Well, it isn't guidance anymore. Again, could be fined up to $25,000, could be put in jail for more than a year if you don't follow these guidelines. And I don't know what the enforcement protocol is, if it's a tip line thing or how it's going to work, but it's there. Now, again, if you want to see the details, the text of this announcement, if it's going by a little fast and you'd prefer to read it, go to coronavirus.alaska.gov. That's a key website for what's going on at the state level, coronavirus.alaska.gov. And you can see this and all of the attachments and other documents. Something else I've seen popping up in social media chatter is, are they posting anything at airports and posting details on what travelers are required to do and so forth? And they are, actually. I have an example of the flyer. It's got this red banner across the top that says COVID-19 alert. All travelers are required to quarantine for 14 days after arrival. And then down in the other section, it says, if you get sick within 2 weeks of arriving in Alaska, please seek medical advice as soon as you can. If you have one, call your health provider. If you don't know a provider, please call 211. And then it goes on to say, for this quarantine, stay at home for 14 days and remain out of public places. Do not go to work, school, or childcare. Check yourself for fever, 100.4 degrees or greater in the morning and the evening, and remain alert for cough or shortness of breath. And if you develop symptoms, notify your healthcare provider. And if you're seeking care, tell the healthcare provider if you have any of those symptoms, fever 100.4 or greater, cough, or shortness of breath. And this emphasizes at the state level something that's been recommended routinely at the local level. Contact your healthcare provider before you go in. It's important to tell the provider's office that you've been outside Alaska recently. And remember, locally, they're asking that you call before you go in no matter what if you think you have symptoms, so they can be ready to put on their personal protective equipment and take care of you while preserving their ability to take care of others. And again, I expect this flyer is available for you to look at coronavirus.alaska.gov. Now, if you're curious about the travel declaration form, we have one of those too, and what it says is, due to the rapid spread of COVID-19 and the high incidence of travel-related infection, the state of Alaska has instituted a mandatory 14-day quarantine for all incoming passengers. The potential for widespread transmission by infected individuals entering Alaska threatens the health and well-being of Alaskans as well as the infrastructure and security of the state. In an abundance of caution and to assist in flattening the curve regarding the spread of COVID-19 in Alaska, The state of Alaska, under its authority to protect the public health, is implementing advanced protocols to ensure all travelers arriving in Alaska participate in 14 consecutive days of self-quarantine to begin immediately upon arrival, allowing for travel from an airport or portage to the designated quarantine location, which, as we just told you there before, is home for a resident or your hotel or wherever you're staying if you're a visitor. It goes on then, the form, what you're expected to fill in. It says travelers 18 years of age and over need to complete and sign their own form. They ask you to list the specific places you've traveled within the previous 14 days. Then they ask for name, home address, your quarantine address, phone number, date and date of arrival. And then there's an area to sign with that reminder down there at the bottom about that if you, I'll just read it. If you provide false information on this form, you may be convicted of a Class B felony and or Class A misdemeanor. Additionally, due to the imminent danger to the public by the spread of coronavirus, if you violate the self-quarantine regulations set forth in the mandate, you may also be convicted of a Class A misdemeanor, punishable by a fine of up to $25,000 or imprisonment of not more than 1 year, or both. So there's that again, and it's on the form, this mandatory declaration. Like I said, I'm not sure where these get passed out, if it's at ticket desks or if you're told to print one, if you're doing electronic tickets or whatever, but that information is probably at coronavirus.alaska.gov. By the way, something else that I saw people raising concerns about on local social media chatter was if you have this quarantine, this 14-day quarantine, what happens if you need food or other essentials, if you need things that are not medical in nature? And the response to that has been that the grocery stores and a number of these industries that are the critical infrastructure will deliver to you. Or there are people in the community, Cordova Neighborhood Watch, especially that Facebook page, there are a number of people in the community that are willing to go shop for people who are quarantining. So there are people that you can let know. And see, this is great about what's great about living here is that there are people who are willing to help you. So don't worry that having to quarantine yourself means that you're not going to be able to eat or get other essentials, because there are a lot of folks standing by in the businesses and just, good citizens who are willing to take care of that for you. And I think a really good place to look is the Cordova Neighborhood Watch Facebook page. You can ask questions, too, from the Cordova Prepared folks, which is sort of our official, for the city, the official flow of vetted information. So they have a Facebook page as well, and you can find details on them on the city website, cityofcordova.net. So we said that there are certain institutions that are more exempt from the quarantine mandate because of being designated critical workforce infrastructure, and we'll go over what some of those are, emphasizing again that these different businesses and operations that qualify under that critical workforce need to have a plan for social distancing and otherwise not spreading the disease around. And there are actually a number of operations under this, so we'll run it down here. It says, functioning critical infrastructure is imperative during the response to the COVID-19 emergency for both public health and safety as well as community well-being. Certain critical infrastructure industries have a special responsibility in these times to continue operations. This is something we've heard before, even at the federal level, where they're saying, well, for the most part, they want the public to stay home and not engage, not come out. There are certain industries and facilities where they really want people to continue to work and do their jobs, if at all possible, with, of course, some kind of a plan in place for keeping everybody safe. So at this time, critical industries and entities defined by the state include healthcare operations, including hospitals, clinics, dental emergency services, pharmacies, other healthcare facilities, home healthcare service providers, mental health providers, companies and institutions involved in the research and development, manufacture, distribution, warehousing, and supplying of pharmaceuticals, biotechnology therapies, consumer health products, medical devices, diagnostics, and any ancillary healthcare services. Healthcare operations also includes veterinary care and healthcare services provided to animals. Healthcare operations does not include fitness and exercise gyms or similar facilities. Another sector of critical workforce is businesses providing any services or performing any work necessary to the operations and maintenance of essential infrastructure, including but not limited to the Port of Alaska, public works construction, construction of housing, airport operations, water, sewer, gas, electrical, oil production, mining, logging, roads and highways, public transportation, solid waste collection and removal, internet, and telecommunication systems, including the provision of essential global, national, and local infrastructure for computing services, business infrastructure, communications, and web-based services. Again, I know that's a lot of words, and if you want to be able to read this, I suspect it's at coronavirus.alaska.gov. Another area of critical workforce infrastructure is defined as the financial services sector, which includes workers who are needed to process and maintain systems for processing financial transactions and services, such as payment, clearing, and settlement services, wholesale funding, insurance services, and capital markets activities, to provide consumer access to banking and lending services, including ATMs, movement of currency, that means armored cars mostly, supporting financial operations such as those staffing data and security operations centers, appraisals and titling, and key third-party providers who deliver core services. By the way, again, as you probably heard, a lot of these institutions are trying to get everybody who can work from home to do so. So that's part of the plans that these different businesses and operations have been implementing. Keep as many people at home as possible. If it's not possible, they're authorized to go to the office, but follow very strict protocols to be able to do that. Item D, first responders are part of the critical workforce infrastructure. Emergency management personnel, emergency dispatchers, court personnel, and law enforcement personnel, all considered critical. Item E, individuals providing essential government functions are critical. That means all services needed to ensure the continuing operation of government agencies and provide for the health, safety, and welfare of the public. Item F, grocery stores, supermarkets, food banks, convenience stores, and other establishments engaged in the retail sale of food and other household consumer products such as cleaning and personal care products. All of those considered critical workforce. This includes stores that sell groceries and also sell other non-grocery products and products necessary for maintaining the safety, sanitation, and essential operation of residences. Item G on the list, food and agriculture, company cafeterias, cultivation, including farming, livestock, and fishing. There's an interesting point. People were wondering about that. Will fisheries be able to operate? Fishing is considered critical workforce infrastructure for the food providing, obviously. Now, there again, there's been grassroots suggestion that fishermen consider quarantining on their boats once they get to town and not just move around freely saying, hey, I'm a fisherman, I'm exempt, I can go where I want, when I want. That isn't how it works, obviously. which I only mention because there have been some people who have sort of been vibing that way, and that's not the deal. Everybody, all of these critical workers are expected to follow social distancing protocols and so on. Moving on to item H, businesses that provide food, shelter, social services, and other necessities of life for economically disadvantaged or otherwise needy individuals. Item I, newspapers, television, radio, and other media services. Wow, so we can keep working. Item J, gas stations and auto supply, auto repair, bicycle repair, and related facilities. This is another one, by the way, that I saw some anecdotal chatter about. What if I'm quarantined and I need gas? There again, I would imagine there are people who will be willing to assist you on that. So you can check that Cordova Neighborhood Watch page, maybe the Cordova Prepared page, maybe get in touch with somebody at the city or with the Cordova Prepared organization and see what's available. Item K, hardware stores are considered critical workforce infrastructure. Item L, plumbers, electricians, exterminators, and other service providers who provide services that are necessary to maintaining the safety, sanitation, and essential operation of residences, essential activities, and essential businesses. Item M, businesses providing mailing and shipping services, including post office boxes. Item N, educational institutions facilitating distance learning. Item O, laundromats, dry cleaners, and laundry service providers. Item P, restaurants and other facilities that prepare and serve food, but only for delivery or carry-out. That goes back to the March 17th mandate. No dining in, delivery or carry-out only. But as long as you can do that, forge ahead. Item Q, businesses that supply products needed for people to work from home. Item R, businesses that supply other essential businesses with support or supplies necessary to operate. Item S, businesses that transport goods to grocery stores, supermarkets, convenience stores, engaged in the retail sale of food, household consumer products, delivery of fuel, or other services directly to residences or other critical industries outlined in the health mandate. So, in other words, suppliers of these various stores that are encouraged to remain operational. Item T, airlines, railroads, taxis, and other private transportation providers that provide transportation services. Item U, home-based care for seniors, adults, and children. Item V, residential facilities and shelters for seniors, adults, and children. Item W, professional services such as legal or accounting services when necessary to assist in compliance with legally mandated activities. So there's some hair splitting there. And finally, item X, child care facilities subject to new recommendations for increased hygiene and social distancing. Child care facilities should be used only by those who need child care to work at a critical job. So if you have kids and you're in any of these sectors that we've talked about, what they're asking is that only those people use daycare, and people who are not on this list keep the kids at home and stay with them. So again, that's a lot of information, I know, and if you need to see it in print, I would imagine you can at coronavirus.alaska.gov. And finally, probably this will seem a little secondary to some of the other things, but something that matters a lot to us, obviously, and that's our school activities. Not surprisingly, the Alaska School Activities Association has announced cancellation of all 2020 spring events, championships, regular season contests, and practices. The decision applies to make that all-state art, esports for the spring season, solo and ensemble, track and field, soccer, baseball, and softball. This decision was based on the following points. Point number 1, on Friday, March 20th, the Alaska Department of Health and Social Services, Chief Medical Officer, and the Governor issued a health mandate which says all public and private schools are closed to students through May 1st. Students will receive instruction through distance delivery methods. All after-school activities will be suspended during this time. Point number 2, for safety reasons, OSSAW bylaws require students to have completed 10 practices prior to participating in a contest. And then point 3, the guidance of state health officials and the Alaska Department of Education and Early Development. So again, no big surprise there. The Alaska Student Activities Association, OSSAW, canceling all 2020 spring events, championships, regular season contests, and practices. What a year to graduate in. I saw a funny social media post, actually, that said, those of you who wanted to organize an epic senior skip day, well played. So that's what we have for this time. Again, if you missed any of it, I expect the show will be going on our YouTube channel, youtube.com/Cordova TV, our companion to the Cordova radio operation. Big thanks again to Cordova Wireless Communications for the sponsorship. They make this possible, our on-demand talk show, which we will continue to offer when a significant amount of information comes in. We certainly wish you the best. Be safe, be smart, don't get fined $25,000 and thrown in jail. And we'll get the rest of our 10 a.m. programming lined out and ready to go for you here on KLAM.